Hello, friends. I just want to make a quick point about the concept of public health. I'm studying it at great length right now, but I just want to mention the word public. So even assuming, that everything else is fine, there is no corruption, there is none of those bad things. What do we mean by public health? I think what we mean is that it is the activity of some particular group of people, the so-called public health experts, who ensure that the total benefit provided to society, the net benefit, the total benefit, let's say, exceeds any costs of their particular intervention. When we approve a drug, we always check for that, right? That's mandatory to make sure that it is better than a placebo. In the case of public health, what is the method we can use? We cannot use RCTs. RCTs are simply unsuitable. What we must therefore use is, I'll explain the RCT issue shortly, is a cost-benefit analysis. That is the only tool that is acceptable for something to be called public health. Let's consider the mask issue. So when there is an RCT in Bangladesh or whatever, I will not go into details about why that's impossible. That's a separate issue I'm discussing in my book. Let us assume that it's all happening and it's all possible, that you've done an RCT and the RCT says, yep, it's all great. The masks are, working or not working. Let's say they're working. So what do you mean by working? They reduce the, let's say, transmission of COVID by, say, 10% or whatever. Then you work out the total lives saved. And let's assume that you have a number. And by the way, all of this should be measured using the age categorization. That means how many of the elderly lives saved, how many young saved, what is the total, expected, numbers of years saved per life. And you come out with a calculation in well-bees, QALYs and well-bees. Now, is that sufficient for making a mandatory mask requirement? I think most of, or I would say 99.99% of the public health experts think that an RCT is sufficient to mandate a particular, policy. But no, that's wrong, right? Just think about it. What are the other things that masks also do, which are not happening without the masks? So the first thing is, in Bangladesh, a person who's earning, say, $2 US dollars a day per family member on average, they now have to spend, say, 10 cents per day on a mask. And they didn't have money for food, so now they have to buy less food or less medicine. So they're buying masks. Okay, so that's one thing. Keep in mind that is just one of the costs. Then you put the mask itself, and you put it on children, for example. Now I know vast numbers of children who could not speak. They've fallen back on their infants who could not learn how to speak and so on. Their IQ levels have fallen, etc. So those are the harms for the children. So what about the deaf people? The deaf people need you to speak without the mask so that they can understand what you're trying to say, right? This is just a few of the things. And then, of course, if you put the mask in the humidity of Bangladesh, have you been to Bangladesh? You should know how humid it can become. And so you're wearing a sweaty mask, and guess what happens with the sweat? The first thing is all the bacteria accumulate. And so you're going to get many more extra diseases of the, throat and maybe other things. The gastro infections and so on, and therefore you have an extra cost there. Now if there is any guy who says he's a public health person but does not give you a cost benefit analysis for a mask mandate, that guy is a quack. He has no clue about public health, right? A public health mask mandate must be accompanied by a CBA saying, okay, this RCT says we can save so many lives using this mandatory mask policy. And then these are the costs. And so we add up and say, yeah, the net benefit. So even though the children are getting harmed, even though, the poor people are suffering, they can't eat enough food, etc., there's still a benefit to society as a whole. That's the minimum. But mind you, there is another layer that you need to do, the distribution of these costs. Who pays? Are the young paying the costs? What is their risk in the first place. So, as you go into the concept of public health, you cannot disentangle it from the concept of a cost-benefit analysis. This, I think, is something I have found is completely missing, 100% missing from the public health literature. Not a single CBA has been commissioned by public health in its entire history, which is not very long, 150 years old, but they never even thought of the idea of a CBA. And so as a result, every single thing they do is based on one part of the whole picture. They will do an RCT of the masks, and then they will claim that, bang, it's so wonderful, it saved so many people, and, wonderful. What about the costs, guys? Can you please tell us about the costs? What about and so the lockdowns, of course, are the classic example where at a minimum they've cost 100 times more. They've cost society 100 times more than any benefit that they've provided. And that's for Australia, Western country, where, there were subsidies given to the people who were forced to stay at home. What about a country like India, where people were just asked to stay at home and they were basically massacred? So in India, the harms from lockdowns are at least, and I would use the word at least, 1,000 times greater than the benefits. And so also in Indonesia and other such countries where lockdowns have just been devastating. As a public health policies, the WHO, led by the CCP stooge, the Tedros guy, who has got nothing, he's basically a communist. If you go back to his history, forget about all that. But let's say he's done some degree in public health at one stage. This guy knows nothing about a cost-benefit analysis. Not once has he mentioned that there is a net benefit of lockdowns, or these masks or whatever things that he's doing. If any public health guy tells you to do something without providing a comprehensive, and I mean comprehensive cost-benefit analysis, that guy's a quack. And so this is the minimum. There's a lot of ethical issues I've raised in my book and other things, the great hysteria and the broken state, etc. I won't go into that. There is a lot of ethics behind this whole thing. The idea that you can encroach in somebody's liberties. And so there are many other layers and layers of analysis that needs to be done. But at a minimum, if you call yourself a science, public health, for God's sake, at least do a cost-benefit analysis. Prove that your things really work, that they have a net benefit to society. Okay, I'm going to share this now, and hopefully somebody in public health will listen. Let's see. Thank you.